Welcome back to this series of videos on staying healthy and preventing COVID-19 infection during the current pandemic. This is video number 17 where we're going to discuss what are the right and wrong administrative decisions that are taken and should be taken to control this pandemic. So those countries took prompt decisions and undertook short-term lockdown, allowing them to have a large-scale testing, effective tracing contact, community screening, and humane individual observation of suspected or exposed people were the one who was successful in controlling the disease quickly. And they managed to reduce the infections and the death rate remarkably and early in the disease. With reference to COVID-19, social distancing would work efficiently only under these circumstances. So testing is an essential part and should not be purely rely on the hospital-based testing, as community-based testing is equally important to identify the community-based carriers and to make determination both the prevalence and the actual spread of the disease itself. In contrast, if you rely on one aspect or one-track action such as total locking down or prolonged curfews are going to be uniformly unsuccessful in controlling the disease spread. If you believe that it's working, that's okay. But point is, all the data suggests that better control can be arrived without this tight restriction and harming people. Also, if such prolonged and unnecessary segregation are going to be needed over months and going to be adhered to, even then such would unlikely to control the disease fully without having sporadic outbreaks. So bottom line is just tight, extremely harsh condition is not going to be the solution on any given country. So why following a failed model? In addition, there are many other areas that to be considered at this stage. Before getting to the more details, let me address another important issue of the only and perhaps the major threat for countries bordering India in particular. Because the conditions are getting tremendously worse in India, especially in the villages, and people are trying to escape the situation and trying to move to the neighboring countries. So one is going to get most affected is Sri Lanka, which is separated from India by only 21 miles stretch of water. So this channel has to be monitored strictly by the Sri Lankan Navy, which are otherwise idling right now. I strongly urge the President of Sri Lanka to direct the Navy to have the full and complete patrol between India and Sri Lanka to prevent any of such vessels reaching Sri Lankan coast or any other neighboring country. So this is extremely important, as even a single boat with a contaminated bunch of people coming there can cause tremendous outbreaks in this northern part of the country, which can then spread to the other part. So it's essentially important that naval patrols doing 24 hours a day for the next few months basically to prevent any such patrol, any such boats actually reaching Sri Lanka. It's also important to note that none of these vessels or the sailors should get on board of any of these people from the boats, as they can easily infect the sailors and cause many problems as well. Simply direct them to send back home. So let's come back to the other consideration. These include, but not limited to, ineffective and advices given on social distancing to prevent spread of the disease. For example, keeping the distance at 6 feet, we know that is incorrect and should be minimum of 20, especially in close encounters like rooms, for example. And the government mandated constant advices sent using cell phone companies to all their customers at times, unfortunately even with the misleading information. So the right ways of sheltering people is another one we addressed in the previous video, and to not putting people together in holes and domes, that's really inhumane and unethical way to do it. Then the need for isolation of the vulnerable people itself, and perhaps the religious leaders from the public for the coming few weeks to couple of months. When to open the schools and universities, the critical need for stepwise opening facilities and businesses to the public, all these are need to be critically evaluated one at a time based on the information and the data. Basically, to open up the economy without further harming it and bankrupting thousands of businesses across the country is not a good option to any country. So, just blindly locking down without having and adhering to an essential and real-time data will only make things worse. In addition, prolonged curfews have major unintended consequences and must not be taken lightly. It is very important. Any government taking such action must be held accountable for such disastrous outcome so as good outcomes. In addition to the collapsing the economy when the country is already struggling to balance its budgets, as in the case of many South Asian countries, including India and Sri Lanka, the increasing rate of poverty, joblessness, hunger, discontent, and increasing rate of suicide, and the stress-associated disorders such as severe depression and post-traumatic syndrome and other psychosomatic disorders are going to be markedly increased in coming months. So health community must be prepared to handle this wave of problems after the COVID-19. This will eventually overburden the healthcare system and negatively affecting the economy in the second wave of problem. Moreover, the number of unnecessary deaths associated with this curfew and post-recovery period is expected to be thousandfold more than otherwise it will be caused by COVID-19 itself. So it's not a simple thing to ignore these unintended consequences. So if this is the case, it's going to create a lose-lose situation for everyone. So let's look at briefly what makes things worse. So COVID-19 is not a plague. So shutting down the country is really not a good option and unnecessary. It is time to let the economy to come back on its feet, and government administrations and the appointed task forces in each country must take smart and act wisely. They must be accountable for the public for the long-term consequences and outcomes. The mainstream mass media in most countries continue to making hyperbolic statements and fake news without adhering to scientific data. This has made the COVID-19 situation hundreds of fold worse, unlike previous epidemics, especially through the miscommunication, biased and politically motivated propaganda to score points. This is further escalated by millions of viral videos circulating in the social media that may or may not be true. Neither of these will help the situation in any given country. Once the dust settles, we must see that the real death rates due to COVID-19 each country is not far different from the annual deaths related to influenza during each winter period. Some of these statistics we discussed in the part 1 and part 2 of this series. Exaggerated fear and panic initiated by and propagated by the mainstream media and by some administrations have markedly worsened the situation, and this is unforgivable. Look at the statistics and the actions taken by countries like Taiwan, Iceland, South Korea, New Zealand, Denmark, Singapore, Finland, Germany, and Japan, for example. Right at the beginning, the leaders of each of these countries clearly spelled it out, the danger of COVID-19 to their public. They described the actions needed and what they are going to do to implement, and did that promptly, decisively in the early of the course of the disease. So that makes the difference of a clinical outcome. In addition, it also created the public trust with the government, which made it major influence on the compliance with the social distancing by the population, but without even need to have locking down or any curfews. They were willing to get tested and comply with all suggested distances religiously in all these countries I mentioned. The results that had a flattening the peak of COVID-19 infection. It is noteworthy that the leaders of this majority of these mentioned countries are indeed females. I'm not sure whether it's coincidental or actually the females of these female leaders actually made the better decision in these circumstances. Perhaps female leaders have more listening capabilities, thus better understanding of the overall situation rather than creating their own and arrogant decision taken by some other male leaderships. Females are more also compassionate and inspirational and had the ability to take decisive and right action promptly for the benefit of their country. Other leaders must follow their lead and do the right thing for the right reason. It is a time to relax restrictions gradually and get the country back to work. Thank you. Be safe and healthy.